Working It Out, a podcast show about diversity, equity, and inclusion in our workplaces, our communities, and our lives. A show where we put diversity and inclusion to work.
Got problems on the job, we're working it out. Workplace got you stressing, we're working it out. Yeah, we're working it out, working it out, working it out.
Welcome to Working It Out. I'm Dr. Vanessa Weaver, your host. On today's episode of Working It Out, we'll be having a conversation on the state of maternal health care among women of color. We are joined by the renowned Dr. Margaret Larkins-Pettigrew, who for 30 years has been a passionate advocate for equitable maternal health care and building programs that aim to improve outcomes for women, people of color, vulnerable patients, and marginalized community. In fact, Dr. Larkins has a lot of titles. She's a healthcare strategist. She's a medical practitioner. She champions diversity and inclusion, and she's also a professor of obstetrics and gynecology. Welcome, Dr. Larkins-Pettigrew, to our show today.
Welcome to you too, Dr. Weaver. It's so great seeing you, and I'm so excited about being with you again today and having a little chat with you. Every time I'm with you, it seems like we're just in our living room having a conversation. So I'm so glad to be here today.
Thank you for coming and really informing our audience on this really important topic. And you wear so many hats. It's amazing to me. Not only are you a practicing physician in obstetrics and gynecology, but you also are the Senior Vice President and Chief Clinical Officer for Diversity, Equity, and Inclusion for Allegheny Health Network, which is located in Pittsburgh and some parts of New York and in other states. So you have a big enterprise. Can you tell us a little bit about what your responsibilities are as the Chief Clinical Diversity Equity Officer? Thank you.
It's a huge system, of course. It is the fourth largest blue in the country. We're in 50 states.
Now, what do you mean by blue? What do you mean by blue?
Blue Shield Blue Cross. Remember, so Blue Shield Blue Cross is a payer. And so we are located in about 50 states as far as the Blue Shield Blue Cross. We have the largest presence in Pennsylvania. We are all of Pennsylvania, throughout the middle of Pennsylvania. We also have Western New York, and we have Delaware and West Virginia. And we have about 47,000 employees. And so we are a payer. However, the unique thing about us is that we own a hospital system called Allegheny Health Network, which really is so special to me because it combines both the payer and the patient. So how do we take care of our patients when we know that there's such a challenge around access to care? And so how do we make sure that the payers understand what the challenges are for our patients and our clients and our communities so that we mirror those together? So we call it a blended system. We call it living health. And it's really how you put those two together.
Well, so in this chief diversity role, what is it that you specifically do? Because I know you address more than workforce diversity issues, but you deal with issues around equity and healthcare for communities of color. So tell us a little bit about that.
So we basically have 5 goals for our institute. So when I first came and they hired me here, the most important thing they did is establish this as an institute. So it is an enterprise equitable health institute. So it's system-wide, which means that we have to touch the lives of everybody we work with, as far as our employees, as well as our clients and as our community. So my job is basically all of that in a bag of chips, as I call it. So it is 5 goals. And the 5 goals are, of course, health equity is number 1. And that is, how do we really make sure that we are practicing health equity within our own system? How are we really thinking about all of those isms that raise their head within our own institution? How are we treating our patients as providers, as payers? How are we letting people come into our system as their authentic selves? So what are we doing internally around health equity? And then what are we doing externally to make sure that our communities are better and that we're taking care of our community so that they're living their best lives? And that can be everything from what my passion is, which is OBGYN and taking care of high-risk moms and babies, but also looking at cardiovascular disease and multiple chronic diseases, and as well as access to care. So that's just one goal. And I am the one who I have about 14 individuals who work in my space. They are experts in DE&I. The next largest piece of that is workforce development. And how do we make sure that people come into the system that not only look like me and you, but that they will behave in a way that can take care of people who look like me and you and everybody else. And so it's workforce diversity. How are we recruiting the best and the brightest to come and stay in our system so they are mirroring our communities and taking care of the communities that look like you and I, that also deals with people living with disabilities, LGBT population, our patients who are veterans who are challenged, our women. So it's the vast majority of those as far as workforce. So I'm responsible for all of that recruitment effort, retention, and promotion. The third one, of course, is workforce inclusion. How do we let people know that they're really included here, as they can come as they are, bring their expertise, and really feel that the 70,000 hours that we put into a lifetime of workforce in our lifetimes, that they're coming to a place where they wake up in the morning and they feel good about coming here, because we're all about service. So how do we make sure that people feel comfortable, feel as if they're included, that their voices count? And so we have this slogan, our brand is called We See You, which is phenomenal. So we want to see everybody who comes in here, no matter who they look like, how they're getting to us. The next one, of course, would be accountability. Big deal. And we want to hold ourselves accountable, and our colleagues and our community supporters. We want to hold everybody accountable for what we do. That means that we want to be able to have measurable outcomes, positive measurable outcomes. And then the last one is specifically academic contributor. We're not an academic institution per se, but we train physicians, we train our students, we train nurses, we have a nursing program. And so we really want to make sure that we're also in that space of being an academic contributor. So all of that I'm responsible for with my team, educational pieces and making sure we're changing policies and procedures. And it's a phenomenal job to have, and I'm really enjoying myself.
Well, my goodness, I can't imagine that you're driving to those 5 goals in addition to having an active practice. You amaze me. Simply.
Oh my goodness.
Well, when you were at our show the last time, and I think this speaks to probably your second goal in terms of how do you provide care for the patients, and what are the expectations that you place on your care providers to be culturally and diverse, sensitive around the diversity topic. Mm-hmm. And you had shared with us that you had just instituted a policy where if in fact a patient decided that they didn't want to be treated by a doctor because that doctor was a race or ethnicity or gender that they didn't like, that they were given some straight talk really about the fact that your physicians are trained and sensitive and competent, and therefore, you all don't really support those kind of preferences.
Yeah, so that is part of what we would call our internal transformational team. We have a team that's called a transformational equity team that we build from top to bottom to up. And it's a set of pillars that I brought to the institution. As part of those pillars, one of the things is that we want to investigate anything that really rises to the issue of the isms. And one of the most important things we found is that patients come into our offices from all over the country, into our hospital systems. And they say, well, we don't want you taking care of us because you're wearing a hijab, or we don't want you taking care of us because you're Black, And just like we as providers cannot refuse the care of a patient because we are about service, then we feel that patients should not ask that about us, because we are an expert team. We as an institution feel that we give the best care, optimal care, have expert teams, and we want everybody on our team to be included in their care. So we approach it from, listen, we understand that maybe you have some issues around that, but we have a no tolerance policy for that. And that we are going to give you the best care because you're the center of our universe, right? So we're going to give you the best care we can because we have experts here. So we have a no tolerance policy. There are some exceptions, of course, if you've been abused or, certain situations of rape, etc. But specifically, nobody gets a pass on that. And so we have a whole team that's educated and is set up that actually goes in and talks with the patient and says, this is who we are. This is what we offer as an inpatient. And if you are stable enough, then you can leave our system and go somewhere else. But we don't tolerate that behavior, and we don't tolerate those decisions.
Oh my
100%
goodness.
of the time, I'm telling you, in my experience, that they don't leave because we have made sure that they're the center of the universe. And what it says to our communities and the other people we serve is that you're going to come here and get the best care you can, no matter who you are, no matter how you walk into the system, because we want you to be a partner in your care. And so that's a really important policy that we need to adopt all over this country, all over the world.
I mean, that's like walking the talk, right? It's like,
Yeah.
Thank you for that.
It's challenging now. It's challenging because, you know, we have some challenging folks, but it still is something that we really, we really support. We really want to make sure that people know that we want to take care of them. It is something that we really, really do support.
Well, I know, Dr. Larkins-Pettigrew, that one of your passions is maternal healthcare, and it's gotten to be a hot topic now, but it's something you've invested at least 30 years of your professional life addressing. Talk to us a little bit about this whole racial disparities in the maternal health care of Black, American Indian, and Alaskan Native women. In fact, some of the data that you provided us told us that women of color are 3 times more likely to die from pregnancy-related causes than white women. What in the world is that about? What are the causes for that?
So, you know, this has been going on for decades. We know this, you know, and so we have enough data to tell us that this is a problem that has been smoldering and has been that Black women and women of color have been subjected to for many, many years. And so it is now the time, I believe, and many of my colleagues believe, is that we put away all the pretense about we don't have enough data to support that this happens, because it does. We know that. And what happens is that women, Black women here in Pennsylvania are 3 times risk of dying in pregnancy during the pregnancy journal, not even just in labor, but during the pregnancy journey that they're taking, excuse me. And then, and babies are more apt to die during the pregnancy journey as well. In New York, it's 6 times. Black women are 6 times have more potential to die than white women. So the data is there. And so it's time for us to really focus on why that happens. And so to understand the root causes. And so we know many of the root causes, and they're multi-layered, and they deal with the women themselves, is that as Black women and women of color, and you can, you know, Native Indians, even Asian women have issues at times. We have multiple women of color who are challenged, but Black women have the highest rate of death. And so Black women wake up every single morning, when they're born, they wake up to a toxic environment. And their entire lives are spent in toxic environments, macro and microaggressions, just trying to be women in this country as far as Black women. And so we know that there's demonstrations that there are changes in the physiology of our RNA and what happens to us as we have all of this weathering, we call it, like when you leave your furniture outside and you know, it's weathered, that Black women have more potential to have more risk factors in pregnancy. They have more, their heart rate is faster. They have more catecholamines. They react very quickly to things because they're subjected to so much during their lives. So there's so many things involved with just women themselves being subjected to toxic things. But on top of that, add what the medical systems have then subjected women of color to, especially Black women, you know, not listening to their voices, not listening to their voices when they cry out and say, I'm having pain, or, you know, I need to be seen because something's going on. And they say, well, and they brush it off. It is something menial. That has happened to so many women. We had so many focus groups that told us that when we took a look at the difference between how white women and Black women and Asian women are treated, it's the Black women who are not listened to. It's the Black women who, you know, walk away sometimes not trusting of the health system. And if you get into that space of not trusting, you know, are you going to come back for your visits? Well, we know Black women come in for their visits when they're pregnant because they are really trying to make sure they have these positive pregnancies. But if you have obstetric racism, where people are making decisions based on their own bias, which is what we have to get rid of, the outcomes are not positive. And that's just one aspect of it. So it's obstetric racism, the toxic life of a woman. It's preterm labor, preterm delivery. Why are Black women more apt to have preterm deliveries and preterm births?
So Dr. Larkins-Pettigrew, you're telling me that there's real data out here that can show conclusively the impact of racism and bias and sexism on the maternal experience?
Absolutely. Data,
Oh, my
so
goodness.
we don't need any more data. It has been studied year after year. We have, you can pull up any, you can Google it. Dr. Google will tell you a whole lot of things about this whole issue about obstetric racism. And we know that bias and racism kills. So
Wow.
it's a given. We just need to deal with it. We need to confront it. And we need to make sure that our providers, that our patients, our partners with their providers, understanding that they have to come together and trust one another to make sure there's a good outcome. And so how do we do that? We have to educate our providers so that they're more literate, that they practice more cultural humility, not competency. Because I don't believe, as I walk around here, there's a whole lot of people in our lives who don't look like me, who will never be culturally competent, but they can really share some humility.
So what is an example of humility? If I have a doctor that's showing cultural humility, what would I be experiencing?
Someone who is compassionate, someone who listens, someone who goes the extra mile to make sure that you understand what you're going home with, the understanding what kind of medications you're on, understand why you are so important to come back to his practice or her practice, right? And so
Okay.
that humility is understanding what you eat.
Yeah.
What you eat may eat very differently than what my diet is. So understanding how each and every one of us come into this existence as an individual, and being compassionate about what is not only in front of us, but what has happened in the past that brought us to this place. Understanding the toxic stress that the Black folks of this country have experienced, especially Black women, as it relates to the pregnancy journal. So that's just one aspect of it. And so,
well, let me ask you, because I know that you are a phenomenal change agent. So what is Highmark Health doing? You're leading this whole diversity effort, not just focused on workforce diversity, but also looking at the health impacts, how diversity impacts the health status. What is your organization, the Blue Cross Blue Shields of Pennsylvania and the hospitals? How are you all addressing this?
So Highmark recognized right away, because of the studies that have been done in the city of Pittsburgh and beyond their footprint, that the death of moms and babies is at the top of the priority of how we need to change that. They saw the death of Black babies in their footprint and said, this is ridiculous, one of the highest in the country. So what they decided to do is invest in it. They said, we're going to put the workforce, we're going to put the money behind it. We're going to try to make sure that we have a program that is not just in one-off, something that is sustainable, that will make sure we see change, long-term change, sustainable change. And because this is not a sprint, this is a marathon, right? So what we've come together and what we created is a program called First Steps and Beyond. Now, First Steps and Beyond is mirrored after other programs throughout the country, but we've enhanced it a little bit more to really identify those areas we think will happen for our communities. So First Steps and Beyond is mirrored after a program that was in Cleveland called First Year Cleveland, one in Columbus as well. And there's a few other ones, but what they look at is number one, that obstetric racism, and how do we dismantle that by educating our providers, educating our patients that they can choose another position. They don't have to tolerate a space where they're not appreciated. And providers to say, okay, here's an ouch. Maybe I shouldn't have said it that way. Let me come back at this in a way that I can really try to be a partner with you. So it's that humility and the compassion and saying that, I may not have it all right, but I am invested to get it right. And so this program really is Highmark as the conductor and multiple community organizations. And this is where the community organizations come into play, who support women. Every woman every organization who touches a woman, we want them to be involved, because this pregnancy journey starts before they are pregnant. And what we've done is we brought people together so they're not working in silos. We want doulas, we want midwives, we want Healthy Start. We want all of these organizations to come together, moving toward this one effort. So if we are saying, okay, how do I affect this outcome? How do I decrease the death of moms and babes? Specifically, how do I decrease the death of babies? Because that means I'm going to decrease the death of moms, because they're going to take care of both of them. And so that program is what it is. So those two components, obstetric racism, preterm labor and delivery. Also, how do we deal with social determinants of health renowned sleep accidents? Why are babies dying, because moms are rolling over, moms and dads are rolling over on them, Why don't we have a big family support system here where we're addressing the males or the partners, even if they're birthing people, how are we addressing their relationships as well, so that they have everything they need to take care of the babies while the babies are at home. And the last one, and the biggest one that I want to make sure we got to, is postpartum. 20% of the deaths in postpartum women is secondary suicide. We have got to deal with that postpartum period. We have to
Secondary, wait a minute. Secondary suicide. Tell us what that means.
So women have, this is the most vulnerable part of the pregnancy journey, which extends well beyond having their baby. This is when moms are depressed. This is when moms don't feel that they're adequate enough to take care of their babies. This is when they're struggling with breastfeeding. This is when they don't have the transportation to make it to their visits. This is all, they don't have enough food. They're trying to take care of other children. And maybe their partners are involved, but don't understand how much they need at this time. At this time, we need to have a wraparound care system for women, especially for Black women who really need to have those rest periods, who need to be, if they look like have some psychiatric issues, depressive issues, we need to really tackle those head on, because the statistic I gave you about the death of moms in this postpartum period is alarming.
Give us that stat again. Just restate that statistic again for us.
20% of the deaths that occur in postpartum are secondary to suicide.
For women of color? For women of color?
Women of color. Well, across the board, but specifically women of color, because as people of color, we don't deal with depression and anxiety like most people. We just suck it up and we think we gotta have to deal with it. We don't talk about it. We just keep going on with our day like we can do this.
Yeah, we know that. I mean, that is so true. We know that Black women in particular feel like we have to be able to shoulder everything, and then we have to be tough, and we can't be vulnerable, and we have to take care of everybody, and often don't take care of ourselves. And you're so correct that we don't deal with depression, don't know how to talk about it. Even in feeling depressed, don't even understand what's going on with us. So I'm so glad that your program is addressing that. So what have been the results?
So we have seen some internal results. So remember, it's every system that touches a woman, a Black woman in the city of Pittsburgh and beyond. So we're starting in Pittsburgh in the community, and we're moving out through our footprint. And so within our own system as Allegheny Health Network, we have seen a significant decrease this past year in the death of babies, right? So I can't tell you the numbers, but I can tell you that it's happening. And so we know it's happening all over the system. We just adopted the centering pregnancy model in 2 of our hospitals here, which is great data as to how we support women in the pregnancy with group care. And so a lot of things that we're thinking out of the box, making the box bigger, because this is part of why we know, women are rock. We need to make sure that they can take care of themselves, produce healthy babies, because those healthy babies grow up to contribute to our economic status.
Yeah, it's an ecosystem.
The ecosystem, yes. Yeah.
So let me ask you this, because when you talked about this sensitivity and the obstetric humility that you talked about, you sent us some research, and I read it from the University of Minnesota School of Public Health. Yes. And it said that when Black babies were cared for by Black neonatal doctors, the mortality rate was reduced drastically. And I was really shocked by that. Are you seeing that experience in the work that you all are doing? Does it really make a difference?
It does make a difference, So, and I talk about this because we know the data shows that even Black providers, whether you have a cardiovascular disease or pulmonary disease, as a Black person, if you have a Black provider, the outcomes are much more positive. And it really lies in the place where, most physicians who are of color have some lived experience around being a person of color in this country, right? And so even if they haven't, Black patients feel that they can get a little more trust from you. They're willing to give you a little bit more slack and say, okay, let's try to work this out so I can communicate a little bit better. The fact that we as providers take a lot more time, because many of us are living in these communities or have lived in these communities. Right. And we want to make sure that we're literate and our patients are literate, so they understand what the challenges are as far as preventive health, what the challenges are as far as taking care of chronic diseases. And so I think that the space of spending more time understanding that we can be compassionate about the loss of folks in your families, about what you're subjected to every single day, some of the challenges related to housing and transportation that we see up front, and that we've dealt with. And I think that there's multiple things it says to us as providers and to our patients that let's try to build more of a partnership. And so that's why you see those positive outcomes, because there's more investment, there's more lived experience and understanding of that. And so I think that, the school's still out about long-term, how that can really translate across other populations, but it works the same way if when you go to see a Jewish physician. If you're Jewish and you're seeing someone who is a Jewish physician, that humility and that compassion also transcends.
Translate. Well, as with our last time you were here, I mean, our time just goes by so quickly. So in the few minutes that we have left, I'd like for you to tell our listeners and our viewers, how can a woman of color and the people that love her empower themselves so they don't become part of the statistic? Maybe they're in a community that doesn't provide the kind of services that Highmark Health is providing. In terms of what can they do? How do they step up to make sure that they're taken care of, to make sure that their voice is heard, to make sure that they're seen? What would you recommend?
So they need to invest in themselves first, right? It always starts with self-awareness, self-care, self-worth. Because even if you step outside the healthcare system, you step into organizations and places where you may not feel that you are self-worth. And that's where it starts. To be self-affirming that you deserve to get the best care that is out there. And so that the international program I have, and just briefly, it's called Just One Door. That one door is spelled WONDOOR. Women and Neonates, Diversity, Outreach, Opportunity, and Research. But what that whole concept came from is that women, no matter where you are, should be able to enter the same door to get the same quality care as anybody else. There should be one door that you should be able to enter and feel that you are going to get the optimal care. You yourself have to advocate for that. But if you're not able to advocate for that, you should be surrounded by folks who can advocate for you.
Okay.
So you have to ask for help. You have to be able to step out. So know yourself, know your worth, and know that you deserve to have optimal care. Make sure you ask for help. Reach out to your communities, reach out to your families. Make sure you're surrounded with people who will have your best interest at heart, right?
So it's okay. So it's okay if she's a little pushy around making sure that people are responding to her.
She can be pushy, but she can be pushy because she can't be unkind. Okay. Because when you cross over from being pushy, means that you're persistent with trying to make sure you get the right care you need.
Right.
That pushy terms in my community could be a whole lot. You can't be cussing out people. You have to be persistent with getting the care you need. And so you can say pushy or persistent if you want, but you cannot be unkind.
I can't imagine how many lives you've already impacted or will be impacted by this conversation we have. So I would just like to say to our audience, if you enjoyed this conversation, please like and share our episode. And I want to commend Highmark Health for the phenomenal work that you're doing in maternal care and looking at diversity implications as you treat communities of color. So I'm Dr. Vanessa Weaver, your host of Working It Out. On behalf of our podcast crew, I wish you a safe, productive, and what we call Be Happy Week. Again, thank you, Dr. Larkins-Pettigrew.
Thank you so much. Take care.
Bye-bye.
Working It Out is brought to you by Alignment Strategies, a management consultancy with more than 3 decades of experience in diversity, equity and inclusion, and organizational development. To learn more, visit alignmentstrategies.com.
Got problems on the job, we're working it out. Workplace got you stressing, we're working it out. We're working it out, working it out, working it out.